So in this video, we want to talk about, what makes our practice, very unique among all the other practices out there doing shoulder surgery. And I think the number one, or some of the top things that make us unique would, first off, would be just be volume and experience. I began my career really only doing upper extremity, but quickly evolved into being a shoulder specialist. And right now we only do shoulder surgery, and we do 700 a year. And when you do that many procedures and the same type of procedures over and over again, you gain a lot of experience and expertise. And within my practice, there's 9 of us on our team, and all we're doing all the time is shoulder surgery. And so you look at, out of all the surgeons in the world doing shoulder surgery, less than 1% only do shoulder surgery. So they're doing a lot of other things. So if this is all you do, and you do an extremely high volume, then your skill level, your outcomes, everything just gets better, your efficiencies, all that stuff. So, we've done over 5,000 shoulder surgeries at this point in my career, and we just keep growing. We keep growing. So, and again, you understand more complex problems. The efficiencies of the operations get better. The practice just runs smoother because the whole team is just dealing with shoulders all the time. Other things that make us unique or make me unique is I trained on what some people consider to be the best shoulder surgeon in the world, Gio Walsh. He is, or at least on the short list, and he taught me so much about shoulders and how to think about shoulders. And really the most important lesson I learned from Dr. Walsh was how to evolve and how to think, right? Because everything's always changing, we're always growing, we're always adapting. So it wasn't like, this is my way. He basically would tell us, this is what I think, but you need to figure out what you think and look at your own patients and always continue to change and evolve. And he really instilled that, in my mind from a young age. And I've continued to try to stay true to that with constant adaptation, constant evolution of our practice. Some of the really cool technologies that come out of that. So one that I'm super excited right now about is this thing called the Speed Patch. And what this is it's a piece of felt. And this material is polyethylene, which is the same exact material that we make out of sutures. And there's a special sewing machine that sews this felt into your rotator cuff on top of the repair that we do. And it increases the strength of the repair 3 to 4 times what we normally do. And this allows us to not wear a sling and fully actively move the arm immediately after surgery, which is very, very unique. The majority of surgeons out there are going to have you wear a sling after rotator cuff surgery. This implant gives us the freedom to not wear the sling, to let you start using your arm immediately because the repair strength is so strong, right? The reason why you wear a sling is because you're worried that the repair is going to pull out, but this makes it so strong. It also decreases pain, and it also increases healing rates because it has to do with the biomechanics. So I'm extremely excited about that, and we were one of the initial couple surgeons on earth to start putting these in, and really are only a handful that have access to it now. And it's a really, really exciting innovation in shoulder surgery. It's probably the thing I'm most excited about right now. Other things that we've evolved with over time are using artificial intelligence-based systems to map out and plan your shoulder replacement. So we get 3D printed guides, which allow us to do very accurate shoulder replacement surgery, also very efficient shoulder surgery. Our arthroplasty times are typically less than 30 minutes skin to skin. And I tell patients the reason for that is, having an amazing team around me, doing a massive volume of the procedures, and using cutting edge techniques and technologies. The technology allows you to not have to do a lot of trialing and templating in the surgery. You do it beforehand, and it's a big reason why we are able to do those procedures so efficiently. And the benefits are, decreased risk of anesthesia and decreased infection rates. So there are real benefits to doing super efficient surgery. Other things that we do in general, just with our arthroplasties and our cuffs, we are really a sling-free type practice. So the sling is for comfort, but we let you start moving your arm very quickly with 95% of the shoulder surgeries we do. We've looked at our data, we've tracked our outcomes for over a decade, and we know we get excellent results doing this, and we make our patients' lives way easier by doing that. So it's a huge win-win for everyone. Other things, talking about, looking at some of the stuff we do that's unique. Well, we track all of our patients, we track all of our outcomes with outcome scores. So we can look and tell you, you're here, this is where you're going to be on average at 3 months, 6 months, 1 year, 2 years down the road for all the surgeries that we do. And when we look at our outcomes, we are in the top 1% of surgeons in terms of the outcomes that we're getting with the surgeries that we're doing. So, we back everything up with data. We back everything up with data, and these outcomes are from what our patients are telling us and what we're measuring in our practice. And our success rates are extremely high for all of our surgeries. We determine success as a patient coming in 6 months to a year after the surgery saying, I'm way better, I'm really happy you did this, I would totally do it again. That happens in 98% of our patients, 98% of our patients. So we have an extremely high success rate with all the surgeries that we do. I think, because of all the different things we do in terms of the speed of the operation, not wearing slings, we do a multimodal pain approach for surgery. So most of our patients really only take narcotics for 2 to 3 nights after surgery. And so we do a lot of different non-narcotic medicines that we do to help minimize the narcotic use, and we get people moving. We also encourage exercise right after surgery. We also have a nutritional supplement that we give to our patients that helps with healing and also helps recovering from anesthesia the day of surgery. So a lot of unique things there. We have home PT programs that we give our patients. So, if you want to just do your therapy from home, that's certainly optional. And we also have the option to do most of your follow-up visits through telemed. So we can just, you don't have to be coming into the office over and over again if you're a very busy person, or if you're coming to see us from somewhere out of state or even out of the country. So I think there's a ton of unique things that we could do, or unique things that we do in our practice that serve our patients in really, really positive ways. And we would be more than happy for you to come see us for your shoulder for those reasons.